Thank you. Good evening, members, to this evening's Health and Adult Social Care Overview and Scrutiny Committee. Do I have apologies for absence, please? Councillor Wiley?
Apologies for Councillor Perfect.
Thank you very much, Councillor Wiley. Councillor Howcroft-Scott?
Apologies for Councillor Cook, and I'm subbing. Thanks.
Thank you, Councillor Howcroft-Scott. I have no urgent business to put out tonight. Are there any disclosable pecuniary interests or other significant interests, or are there any declarations of whipping on tonight's agenda, members? Great. I just want to add, you remember last week that I explained that the ICB were currently unwilling to sign the letter to the Secretary of State regarding pharmacy provision and related legislation, and there was an action from our October meeting, if you will recall. The ICB have since drafted a separate letter which they say complements the letter from us, the HAS Committee, and the Director of Public Health. I feel their letter was not in line with our letter, and I've decided that HASC and Public Health will send our own letter to the Minister stating our disappointment with the ICB not countersigning. There was really nothing in there that was pulling out the ICB or any of us. It was just us joining together and doing it as a group. And unfortunately, the response we've got back is not what we would have wanted. Just moving on, members, can I remind anyone speaking this evening that to keep the introductions to a bare minimum? Members have read the papers, so please use the introduction to update members on anything not included or to draw attention to the very key points. I now hand over to Scott Elliott for item 4, the suicide and self-harm strategy, please. I know you're going to start with a warning, Scott.
Thank you, Chair. Just want to remind members and anyone attending the meeting, watching the meeting, any discussion of a suicide and self-harm is potentially distressing, so do make sure you're emotionally prepared, comfortable, and take steps to look after yourself and anybody else that might be affected, and just consider that throughout the whole of the agenda item, if that's okay. Today we are here on behalf of the Suicide Prevention Strategic Group. This is a multi-sector, multi-partner and cross-county strategy group that's working to reduce the incidence of suicide and self-harm across Kent and Medway. The Suicide Prevention Strategy Group and Self-Harm Group meet regularly. We meet every 3 weeks. The core elements of the action plan that we're currently working on, the funded elements, is around suicide mental health training, campaigns such as Release the Pressure campaign, which you know would have seen around, suicide bereavement services that are commissioned to Amparo, supporting people after bereavement. Other funded elements include money and mental health services, showing the link between poverty and debt and suicide ideation, and a whole range of community funding. What we're here today is present the draft suicide prevention strategy, ask for support, ask for observations and input from members. It will then be officially ratified by Cabinet members in Medway Council and Kent County Council as a cross strategy. One element of the project this year has been successful, has been our Baton of Hope initiative right across the county, and we've got a very short video just to kind of show one element of the strategy action plan.
The Baton of Hope is walked around for mental well-being as a symbol to help prevent suicide and struggling with your mental health alone.
The Baton of Hope is a recognisable symbol that talking about suicide is not only okay, it's encouraged.
I'm incredibly proud this leg of the Baton of Hope. The Medway and Kent leg is starting right here at Mid-Kent College.
We get to pass the baton to the next person, and a lot of these people have been really personally touched.
It's really surreal to me that so many people have come down today to walk with the Baton of Hope or support the Baton of Hope.
Hearing people's stories and seeing how much the baton means to them, and seeing friends or family that they've lost. It's obviously quite emotional, but it was good, and you could see the message getting through.
Everybody's got a role to play. It's everybody's business. And you are the people who are helping to spread the word of hope.
It's breaking down the kind of the taboo of suicide. It's okay to not be okay. There's help out there. Just that physical symbol that is perhaps needed to get people talking about it.
It's beautiful, isn't it? Absolutely beautiful.
I think it's really heartwarming to know that organisations are opening their doors and trying to be a part of the conversation around suicide prevention for Medway. And we've seen that today with, you know, the cathedral opening up for us, the college opening up for us, the dockyard.
Suicide is such an awful thing, and to be able to come together and in such a hopeful, bright, happy way, it just feels so powerful.
Today is about our community. Today is about saying a very simple, clear message. We're passing that hope on from one to another.
This is bringing a lot of people that have kind of experienced similar things together. They know what each other are going through.
People that aren't trained in mental health still are ready and comfortable to hold that conversation. And I think that's the main thing of what today is about.
For Medway, it's opening up the conversation.
You should feel comfortable telling people that you're not okay, and likewise feeling comfortable asking your friends, are they okay?
Essentially, this is about promoting talking. It's about promoting that you're not alone. And nationally, we can come together to help each other.
So just final thing to add, on average you see about 160 suicides across Kent and Medway each year. That's 160 too many. It's 160 sets of families, it's 160 friends and loved ones. So the more we can do to support the initiative, the quicker we get that number down to zero.
Thank you, Scott. And it's a really powerful message. It's okay not to be okay. I think that's something we should all take away from us. Members, questions, please. Councillor Wildy.
Thank you, Chairman. Thank you, Scott. It was a very good film. Who made it, if I can ask? Was that council or was it the college? Or?
So that one would have been a council, a video, made video, yeah. Well, a contractor, yeah. Yeah. But it was very much in partnership, obviously. The Baton of Hope was such a unique project whereby literally we said, can we open the dockyard? Yes. Can we get a boat moving up the river from Kent Fire and Rescue? It was a really good symbol of how partnership working works.
Yeah, no, it's very good. And I'm pleased to be part of that as a small part of the council. Couple of comments on the papers. We are being compared on page 19 at the suicide table comparison. I would prefer the headlines were this year against last year, etc., and hopefully see a downward trend. Because comparing us to almost anyone else, the numbers are relatively small. So, you know, small events can make a big difference. So, yeah, that's just really a comment. And further down that page, you mentioned two things. Excuse me. You talk about domestic abuse and male domestic abuse. Can you tell me, and I don't know if you're able to, but maybe later, what do we do for our domestic abuse victims, males? We all know we've got you know, places women can move into, etc. But I've asked this before and never had a satisfactory answer. You know, where do we have that men can move out of their home if they need to into supported care of one sort or another? Do you know those?
I'm aware of the service, but I don't want to give the wrong details. But we'll definitely get a briefing for that on you, yeah. Okay. On the male domestic abuse service.
Yeah, thank you. And other than that, I think it's a very good report and good work.
Thank you, Councillor Wiley. Councillor Hamadishi.
Thank you very much for the report, and I was glad to be part of the Baton of Hope. It is such a initiative, I had a tooth taken out. It is it's such an inspirational journey that Medway will go on when it comes to the Baton of Hope in raising awareness to suicide prevention. I like the fact in the report you don't talk about committing suicide, which is one of the biggest blockers for people to come out and talk about suicide as if they're broken a law. You don't commit suicide, you're not breaking a law. The fact that we are having open and frank conversations and enabling people to go into difficult spaces as it relates to their mental health is so important. The numbers, the 160 is one too many, obviously, but it's a journey that we're on. The more exposure that we have amongst people, the better, and the better health outcomes we have for everybody, because it's a health issue more than anything else. So no, thank you for doing that. Thank you.
Thank you, Councillor Hamadishi. Councillor Printer.
Okay, thank you. Sorry if you've covered some stuff already, because so I was a few minutes late there. Unfortunately, in my day job, we come across suicide a lot, working on the trains, and we've had a rise, it appears, locally with suicides involving the railway. Our platforms are not really conducive generally with suicide hotspots because we don't have fast lines. However, it's not helpful with the press because the press are highlighting sites, access areas where people can access, say, the railway, because it is quite hard to do suicide, and it doesn't take much through learning through Samaritans that we've had training. All it takes is one intervention sometimes, and it stops that on that day. It can be a conversation, it can be a small fence that's in the way. So really, are we working with Network Rail on that? Are we working with the press to say, don't, you know, obviously, if you're going to report, you can report it, but having photos of the exact area that it's happened isn't helpful for other people. Are we working with Network Rail? I noticed in the report, they're not pictured as one of the partners in the report. I know they mentioned later on of having some work, but what's that level of work? Because the platforms sometimes are not managed by Network Rail. I don't know what the arrangement is here in Medway. Sometimes they're managed by the train company. Some platforms, stations are managed by Network Rail. Are we having that work? On the report itself, it was different reports for each cohort, adults, children, and they've gone together. Suicide is quite different, isn't it, in different groups? How it's done, the issues. Are we going to cover everyone with it all with one strategic report? Because 75% is still by men, but we're doing one report for all. So are we confident that the report will hit all that, will be able to cover everyone? Thank you.
Thank you, yeah. I would say National Rail and the rail operator, so it's Network South East in South East, are an incredibly supportive, reactive, responsive partner. I could not praise them enough, genuinely. They do so much. The amount of presentation, so there's a number of hot spot train stations where the National Rail have. Unfortunately, one of them is located in Medway area. The amount of interventions that happen that we just don't see. So the thing around suicide prevention work is it is very, easy to grab a number around 160, and we see but the amount of times that's prevented is, is significantly higher, which presents its own problem. Why do people get in that situation? But the staff at the rail do an incredible job at all of our stations. It is quite rare for us to see the two, particularly in the station we're referring to more recently. I'm naturally going to be very light on specific details for obvious reasons. But incidences, where particularly if we get multiple incidences in a close swing, immediately we form an incident response team. So National Rail and the operator are on those immediately. Site visits, making sure what can we do, email exchange yesterday to find out who owns particular land around the area to make sure we do our best to kind of minimise if somebody is feeling as low as that. So yeah, National Rail and the South East Rail are fantastic. The training they deliver for their staff via Samaritans who do see the rough end of that is really responsive and really, really positive. So yeah, they're an excellent partner, and we're lucky to have that support from them. In terms of the language you use, you're right, you know, and mentioned by previous councillors around taking the horrible word committed out of it. It is really, really important that the media report this stuff responsibly. It's really, really important our social media channels now have good access. Really important our AI machines are generated to give, you know, good responses to people that are feeling vulnerable, young, you know, or any age. And we do see a big variation in that. We have had conversations with one particular mediator recently to kind of say, these are standards. Samaritans put out a really good piece of communications advice to anyone having a conversation around choice of language, and they do some of that work with us on behalf with the bigger press things, because obviously the press is a huge kind of group, and with social media channels, it's a group that we can't always engage with, unlike we can chat to, you know, the brilliant Colette in the rail station. So that's a harder conversation, but absolutely one we look at. If we see some what we'd classify irresponsible reporting, we would make contact with them directly as a strategy group, or the Samaritans do that on our behalf or their media team. And in terms of merging reports, sorry, finally, this is the first strategy that does merge the two. So previously, a previous iteration of strategy has been a children's strategy, and this is the first one that merges self-harm and suicide. There's no perfect science to it because those three things will blend into it. So when does one person? So this is our first attempt to kind of do it as a collective. We think it has merits and positives, but we actually kind of take the point around, you know, how do we make sure we differentiate? In terms of the action plans, there are separate subgroups and separate working groups. So the strategy wants to kind of say, because they are all kind of linked, these are the kind of key things we want to achieve as a collective, but there are kind of separate work plans and separate action groups to kind of mitigate the different risks and different risk factors we need to think about.
Councillor Prenter, can I just check as well, from a looking after the staff point of view, because you've got that internal experience. Obviously, a suicide is a terrible thing for families and for the, you know, everyone involved, but it's also a really hard thing, isn't it, for the incident teams that have to go. And is there good care and I can imagine there is, but is there good care and resource? And do you see the after effects sometimes of people that are impacted by that?
Generally, it is. I think there isn't one size that fits all. There are some drivers who can come back to work the next day. There are some drivers who never drive a train ever again. They just can't face it, and they, you know, but everyone is different. So as long as that care and wraparound care, and that will include everyone. That includes the coroner that has to turn up, the fire brigade, etc., the police. Yeah, it's not something that you want to see, but it's that wraparound care, and it's really important that they get that counselling from an early stage as well. But yeah, it's not one size that fits all.
And I know, Scott, you've said that the Gillingham station team are really good, aren't they? On a day-to-day basis there, aren't they? Councillor Finch. Councillor Finch, just your microphone there.
Thank you. This is a hugely important strategy. Many of us in this room and many watching at home will know someone who's taken their own life. I've lost 3 close friends myself, Kit, Bob and Paul, all men. So this matters deeply to me, and it's why I've probably got so many questions about this item. It's given that Medway's suicide rate is higher than Kent's, why is there no dedicated Medway suicide action plan? Do you accept that the Medway is effectively being bolted onto a Kent-wide approach, despite having worse outcomes? Given that 3/4 of those who die are men, why has the council not produced a dedicated men's suicide prevention plan? Do you accept that a generic
Councillor Finch, if I let him take the first 2 or 3, is that right? Because there's quite a few there.
Okay.
Scott, have you got if you need Councillor Finch to repeat, let us know. But then once you've got so far.
So the papers that you have is part of the consultation papers as part of the strategy. Since the strategy was published in its draft form for obviously community consultation purposes, there is some refreshed numbers that come through. So numbers are rates for various reasons and looking at and be able to compare different groups. What we have seen is a reduction in the Medway rate. So the Medway rate is a per 100,000 rate. It's over a 3-year period. So Medway is actually 10.3. Kent is 11.3. So we are now below the Kent average. We're not celebrating that because 10.3 is 10.3 too many. The England average is 10.9. So we are just below the England and South East average. So that's something positive. But we are talking small samples, so we know that can go up and down. The reason that it isn't a Medway strategy or a Kent strategy and is because of we work with really closely with South East Rail, and obviously the railway lines, goes across. So we do generally think this is one of those agenda items where we're working cross-border is really, really critical. And I would say from an officer perspective, there are sometimes challenges working across a system as big as 1.9 million people. This is an agenda whereby we don't have those issues. It is probably because of the agenda being so emotive around people see it's important. There doesn't seem to be any kind of barriers, whether that be sector-wide, political, party-wide. This is a kind of apolitical issue, and we work with our partners really, really well. As I mentioned, that 3 weekly working group, always attended by our ICB colleagues, always attended by the Kent and Medway Mental Health Trust, always attended by KCC officers, always attended by Medway Council officers, and we take our kind of, personal loyalties out on that, and we work more collaboratively. There are individual actions that are very focused on Medway, particularly, just beyond Medway, okay, so we talked about an incident earlier on, doing some really focused work in the community and a ward to understand there. So we work strategically, we think globally, but act locally.
Councillor Finch, you want to carry on with your question?
Fantastic, yeah. So on the dedicated men's suicide prevention plan then, why has that not been put into place, considering 3/4 of victims are men? 69% of people, your data shows, who died never reached mental health services. Is that evidence of a failure in identification, referral and access locally? The consultation, it was a 10.5-week consultation across 2 counties, population of nearly 2 million, but only 149 people responded. Do you accept that that's a failed consultation and cannot reasonably be used as evidence for strong support, as said in the report? Yep.
In terms of the men's strategy, it hasn't been viewed as that. As I said, there's individual men's actions, so the strategy objectives are clear for men or women, but there are definitely some very focused men's work, working with Dad Space as a prime example more recently. In terms of whether 68% present is that a failure in the system, I'm not sure. If they're not reaching those systems and access pathways, I don't know what bit of the system's failing. Clearly it's a failing on society if people are feeling that low. But the final question around, do I accept what was the last one, sorry?
That's the consultation process. Only 149 respondents.
I'd like to see more. The good news is, the vast majority have agreed with what's in there. I don't think that's a particularly low response. If I consider other strategies, we aren't seeing a huge amount of responses throughout. It was, really good attempt from the officers that run the strategy, went out and had really good dialogue. The Baton of Hope project, for example, brought so many more stakeholders, but we did have 250 people last week attend the Kent and Medway Suicide Prevention Conference. It was kind of sold out within really quickly. We had, our own portfolio holder for health, so did KCC's portfolio for health. So I don't think engagement across the sector is a problem and an agenda, thankfully. I think everyone realises 162 million want to work together. I mentioned the strategy group, but there is a much bigger network that anybody is welcome to join, and that meets quarterly, and we have a really big representation from a number of sectors on there.
I was in the local GP surgery today, and I was looking through the literature on display, and there was not one on suicide prevention. There was one on claiming compensation for asbestos, things like that. I would have preferred to have seen something there.
Was Release the Pressure on there?
I'm not sure.
Okay.
There was one about anxiety, I think.
If you let me know the surgery, we'll make sure Release the Pressure campaign materials in there. Same way if anyone sees any area hotspots, really keen to get Release the Pressure as our kind of main key matrix out there. Anybody that sees any that isn't there, will happily go out and make sure it's on there.
Excellent. The report says that it's vital that everyone feels confident talking about suicide, yet refuse to make training mandatory, even for frontline professionals. Is that a good idea?
I would like to see as many people trained as possible, but I can't speak for all educators, educating systems and anyone else in all professions. But yeah, we offer that part of that training.
We should be pushing for that.
We definitely push it.
Yeah, okay. I agree with Councillor Prenter as well, that children and adults have very different risk factors, and we've abandoned the separate strategies. And it seems like you're doing that just for a test to see how it works, without having any real data on it.
But there's individual action plans. The strategies are kind of overarching. These are the over ambitions. These are the key strategic priorities. But there's definitely specific actions for those children and young people. Please don't misinterpret that.
Okay, lovely. And the funding comes entirely from the ICB. Medway contributes no additional funding at all. So how can we as a council claim suicide prevention is a priority when it invests £0 of its own budget?
Yeah, so that's around the work plan and some of the things, so things like paying for the Baton of Hope projects. We have dedicated officers working on the suicide prevention agenda, so do KCC as well, so they're funded out of the public health grant.
And that comes from the council budget?
Council's budget, yeah.
Okay, lovely, thank you.
Councillor Prenter, did you want to come in?
Yeah, just on that point from Councillor Finch, I was just asking if you were happy with the strategy being put together, and I was happy with your response that there is a separate strategy. So I just want to be clear, not being mixed up with saying that I didn't agree with the policies being split. Thank you.
Thank you, Councillor Prenter. And Councillor Finch, obviously, true what Scott said, just said, but you have more than, you know, I always say, anyone in practice that don't see the things they want on the wall, go straight to that practice manager and they will probably find it in a bit or give you a reason for it. Make sure you do challenge it. Councillor Jackson.
Until you started talking about the railways, but last year I'd missed a connection and I ended up sitting on Rochester platform for just over an hour, and I was approached by a member of staff and just to make sure that I was all right, which was wonderful. They said, you don't look agitated, but we just feel like we need to check in on you. But I am really, really pleased about this strategy. Suicide plays a big part in my everyday life. My 10-year-old tried to take her own life, and just last week she said she has a new plan. And I just think how far she's come, because people are talking about it, and she told me that that's what she was starting to plan. And I do think the Baton of Hope, and it's about the conversation. And yes, we have problems with, at the moment, with our mental health services, but everybody, all of us, can start that communication and start spread kindness and talk to people. And I think things like this and the Baton of Hope are the start of them conversations. So thank you for all of this, and I'd love to see where it goes even further next year. Thank you.
Thank you, Councillor Jackson. Councillor Shocker.
Thank you, Chair. Just a couple of questions regarding the strategy and its impact from funding restrictions, potential funding restrictions. If they come about, what clarity can you give us on whether the programme is financially resilient and whether the contingency plans exist to find further funding for it? Secondly, 75% of those who died by suspected suicide in Kent and Medway are men. Are the council looking into doing specific research pieces in how it can look into men's mental health in Medway?
In terms of funding, as I mentioned, so the ICB fund the delivery plan within the strategy action plan. And then KCC officers and Medway Council fund the officers that work around there. But there's a lot more, you know, if we counted all the individual actions, the Baton of Hope, you know, all the partners that kind of contributed to that, they're not kind of costed. We've had no suggestion from the ICB. They're not going to prioritise this strategy. It's going through their own governance process. It's on their agenda to go through. So I'm hoping that their commitment to the strategy and signing it off, as our Director of Public Health and the Kent's Director of Public Health will be doing, co-signing the forward, is a good sign that they're committed to this agenda. if any funding changes across any public sector body, obviously we need to strongly consider that, but we haven't got any backup plans because we're not seeing it as an immediate risk. And in terms of the 75% question around men was...
Is there any specific research pieces you can look into?
We haven't planned any research pieces. I haven't got any on the original. There's nothing forward on the HDRC research. Not to say there can't be, and obviously really keen for the HDRC to carry on growing and working in that kind of space moving forwards.
David, do you want to come in?
Sorry, thank you. So with any piece of research, the key thing is to develop the right research question. And the way the HDRC works is we're open to anybody coming to us with ideas about research questions, and then we work with them to refine them to an answerable question. So if you have any specific suggestions, then the HDRC team could work with you or with anybody who has a suggestion to see if we can develop a research question that can get funded.
Thank you, Councillor Shocker. Councillor Campbell.
Thanks for the report, Scott. It's really positive, very encouraging to see, especially like where you say make suicide everybody's business, because it really is, and everyone comes in contact potentially with someone who could be in that situation in life. And like others have shared here, I've also got personal experience of this. So one thing, again, from my personal experience, I wanted to ask how much of this is known to or available to faith groups. And the reason I ask is, you've got this wonderful picture of how many people are involved, organizations are involved in the Kent and Medway suicide prevention networks. But there are faith groups. I mean, my personal experience has been through churches, so I'll talk about that. But of course, it extends to all faith groups. There's a lot of outreach work that churches do. They kind of intentionally and deliberately will want to go into the deepest, darkest corners of communities, because that's kind of their mission. That's what they want to do. So they're talking to people who are kind of pretty high on the deprivation markers, right? And what I've encountered is there's a lot of compassion in those church outreach projects. There's also a high amount of ignorance when it comes to mental health, especially around men's mental health, because they can be quite conservative groups where men don't find it easy to talk about, and as your statistics show that it's a real problem. So some of the things I've encountered in churches is people showing up to my house, cooking meals for my family so I can just sit in a warm bath and cry, for example. That made all the difference one day, right? But equally, I've had other people come and tell me, we need to pray the spirit of suicide away from you, which was really upsetting, actually, because I was feeling extremely vulnerable. And it comes from a place of love, and that's how they saw us helping. But also, I've seen in some church circles that they are reluctant to refer out to other organizations, like, say, Samaritans or something. They kind of feel like we won't be understood as a faith group. We need to keep it in-house. We need to put our own interventions in place. So there's some barriers to be broken down there. And I know as an Asian in my community, like, we don't talk about this. Indians don't talk about suicide. It's just so shameful. So I would love to see some representation from faith communities in these conversations, especially maybe some kind of training for those people who lead pastoral teams, because there are people who will be in charge of, one-to-ones with other people or welcoming new people into churches and stuff. So if they can be skilled up a little bit, what to do and how to advise, I feel like we'd be reaching a whole new community of people. So just wanted to share that and ask what your thoughts are.
I think it sounds brilliant. One of the great things that all ward councillors have is connections in the community that we may not have as officers immediately. Any doors you can open to us, whether they be faith group doors, particular employers that have a high proportion of men, whether you have part of an ethnicity support group, the data does show some particularly high-risk groups, and we would love to offer that. We genuinely believe in training. I'm sure you're aware of the Better Medway wide range of training, whether that's suicide prevention specific or just around how to have a conversation with someone, that motivation interviewing bit. We offer that training for free. We are always open as a strategy group, suicide prevention strategy group, to think about what more purposeful stuff can we do next year that's really on there. So if you've got any specific ideas, there's a particular gap area, just drop me an email and we're happy to have that conversation. We've got a particular building, venue, faith group on there. I mean, you saw on the picture there, the Dean of Rochester Cathedral, absolutely open to that, really keen and open their doors. I don't believe people wouldn't, but I do acknowledge there are some people that don't want to talk about it, whether that's a shame, ignorance of a kind of issue, but that comes with that training, building that confidence. So yeah, any doors you can open for us, really happy to walk through them. Thank you.
Thank you, Councillor Campbell. Councillor Nain.
Thank you, Chair. From the stats, it says...
Councillor Nain, can you turn your microphone?
Sorry. 69% of individuals who die are not known to secondary mental health services, which I think, how do you think we can expand community-based intervention? Because like the councillor said, Campbell said, sometimes when it comes to faith groups or religious bodies, sometimes they see to be some of these mental health issues to be spiritual because they don't have enough knowledge about what is mental health. So how do you think you can work within the community to create that awareness? Because if 69% is not known, because they might have mental health issues, but they might not see it as mental health, and they'll see that it's a spiritual issue, and they tend to maybe, based upon their faith, either decide to pray, hoping that the person will be healed of something, but it doesn't work. So how can we get most of these faith groups to have an idea or to be educated on this mental health so that it doesn't get out of hand before suicide sets in?
I think the key thing that I learned during the COVID-19 pandemic was the messenger is as important, if not more important, than the message. So this is, I think, where the committee members and all ward councillors kind of kick in. Having that conversation in your own workplaces and saying, no, this is a real issue, and doing it in a language that people don't feel. I play football on a Saturday with a group of guys. I'm going to probably talk a different language to them as I may do this evening because I want to be kind of understood and here, but I wouldn't, shy away from having a conversation around, someone really kind of struggling. So I just think it's genuinely about as many partners having that conversation, that faith group leader having that, and if you might be, you might be close to that person. If you can get that conversation going, no, actually this is a trusted group. They're not going to come in and judge you and do that thing. We open that conversation around mental well-being. Maybe not talk about suicide straight away, talk about mental well-being because that leads on to that, doesn't it? So yeah, the more help we can do would be really positive.
Thank you, Councillor Nain. Just from me, Scott, everyone's asked some really great questions and observations. I don't have any. I think mine's just only to say thank you for the strategy, because for you, Councillor Finch, there are a lot of places that don't have that don't even look at the strategy, don't even look at what's happening. And I want to reassure everyone, as Scott would definitely know, there are so many charities and organisations out there that are doing some of the work behind the scenes that we may never know about. People that have lost, people that are struggling with maybe coming out, people that are struggling with poverty, people that are struggling with marriage breakups. And that's why we're lucky, I suppose, that we have our unions that back up people that may have lost their job unfairly, etc., etc. And the one thing I will say from a man's point of view, it is something that many of us have spoke to our colleagues, or the male colleagues here, have spoke to many men and female, I probably have, and sat and tried to speak to them, but we're not all the same and going into the pub and talking about our own internal problems more as much as we should. And it is those ones that sit on the platform on their own you have to look out from. It is those people that are indoors and you haven't seen for a little while. We all have a duty of care, I feel. Not just councillors, public have a duty of care to individuals and to watch out for our friends and our neighbours and stuff. And maybe that's been lost a little bit over the way. But there's not despair here, because there are loads of charities and loads of organisations that are doing some great work, and those little heroes out there that are on the Samaritan helplines as we speak, talking to people as they've even taken an overdose and moving forward. So let's have a ray of light on it. But I do feel, Scott, that at least we've got Southingcon moving ahead, and if we can get down from that 160 next year, it's not a victory, is it? It's a step in the right direction to try and help people that we need to help. So thank you very much. Councillor Campbell.
I move that the committee notes the report and recommends the strategy as set out at Appendix 1 to the report to the Cabinet for approval. A separate briefing will be shared with the committee members on domestic violence support services, specifically for male victims.
And maybe Scott or Councillor Campbell, you can lead the way in we'll send some bits over to Scott or send them to who we need to, Scott, around that community element stuff. So that'd be great. Oh, you've all emailed already. Is that seconded? Seconded. Agreed, members? Agreed. Thank you very much. Thank you, Scott. Thank you very much for your time. Can we now go to item 5, commissioning care? And Karen, you're leading on this just to give a quick highlight because members have read the report.
I'll provide a brief overview of the adult social care brokerage and its role in commissioning care across hospital discharge and community settings. I'll also outline our performance, challenges, financial impact and future plans. You'll all be aware brokerage work aligns with key legislation, the Care Act, the Health and Social Care Act and NHS discharge guidance. These frameworks ensure we deliver safe, timely and person-centred care. Brokerage teams source care for older people, mental health, learning disabilities and physical disabilities, and they source things such as residential nursing placements, supported living, respite, home care and discharge to assess beds and rehab beds. We operate 2 dedicated teams, the community brokerage team who handle community referrals and the IDT brokerage team who were introduced in 2023 to provide a dedicated focus and expertise in supporting people's discharge from hospital at pace. Operational highlights for the team: they attend daily and weekly best practice panels to secure timely decisions. They negotiate costs under framework agreements and spot purchases. We recently introduced the Mosaic Provider Portal for real-time care delivery recording and to enable payment for actual care delivered as opposed to planned care. And we are currently exploring e-brokerage solutions to automate processes and enable robust reporting. Regarding our performance, in the period November 24 to November 25, the IDT brokerage team supported 519 discharge cases and the community brokerage team managed 1,434 home care cases, 192 residential and nursing placements, 156 supported living and 145 respite placements. And in addition to that, both teams worked together to apply and find 480 home care variations. Some of the challenges that we face currently include cost disparities between health-funded and social care funded placements. Currently, there's limited provider capacity, only 61 vacant beds in Medway as of November, and the majority of these are private and costly. Manual processes create a challenge for us as well due to the administrative burden and lack of robust reporting tools. But the e-solution would address some of those issues. The financial impact of the team: active negotiation delivered in excess of 400,000 in annual savings and £750,000 in cost avoidance for this financial year, and there's still a bit of the year to go. To support market sustainability, the team used CareCube to benchmark fair cost of care, so it's kind of supporting those providers to ensure that we're offering them a fair cost of care whilst also protecting the public purse. You'll see from the report that the risks identified are workforce and market capacity pressures, financial risks from tariff variations between what adult social care would expect to pay and what our colleagues in health would expect to pay, and what the private market would expect to pay for a bed. Delays in digital implementation, and safeguarding risks if sourcing is delayed. So future plans for the team: expanding provider capacity at band rates, working with our colleagues in commissioning to have good conversations with providers, implementing e-brokerage for efficiency, transparency and reporting purposes, and continued collaboration with ICB and commissioners. In summary, brokerage plays a critical role in ensuring timely, cost-effective care for Medway residents. We're committed to improving efficiency, managing risk, and supporting safe hospital discharge and community care for Medway residents.
Thank you very much, Karen. Members. Councillor Wiley.
Thank you. I have recently had a briefing on this from Sue and Karen. Sorry, I'm terrible with names, but yes. Which answered most of my questions. But this evening we've heard quite a lot about the finance, and at 3.8 you just talk about the quality of the providers that we use. Can you really give us confidence in the providers that we do use and the quality of care that they provide, please? Thank you.
So, in addition to overseeing brokerage and self-directed support, I oversee the quality assurance team as well. And they do daily analysis of the quality of the providers that we are commissioning. They will go out and provide support to those providers if they're identified as maybe not achieving our benchmark for quality. We have surveillance groups. We work across Kent and Medway to identify potential issues so that we can address them early. We can go into those providers and provide training. We analyse their training to make sure that when we're placing people with them, they're trained and competent in specific areas.
Thank you. And just one more question, comment. When we spoke, we were going through the commissioning process for, future years. Can you tell me where we are now with that? Is that complete, still happening, etc.?
Thank you, Councillor. So the recommissioning of the older persons residential and nursing, so that's a new framework to set new band rates and criteria on band rates, should go out on the portal soon. So it's a sensitive moment. We're in that sensitive period where we can't discuss it, but it's going forward.
That's fine. And Chair, if you don't mind me saying, I only mention that because we do quite often question the ICB, etc., when they are commissioning services, and we, as well as them, do have difficulty with the process. That's the point I was trying to make. Thank you.
Councillor Wiley, I do understand it, and I think I've said to Sue as well, sometimes it would be good for us to, we don't have the capacity, we certainly don't at the moment to see those ideas and procurement ideas coming forward in advance, but we are able to look at that once it's procured and ask questions, and that will be assured. We will be able to do that, and I know Sue is more than happy to come back and once you get out the phase of procurement, we can question, can't we, Sue?
Absolutely, would welcome it, Councillor.
Thank you both.
Councillor Campbell.
Having trouble with mics today. Yeah, thank you for this report. It's really interesting reading, and what strikes me is most of your challenges are systemic. It's just in how the commissioning works. So how do we compare as Medway to other authorities? Is this the picture for everybody? Do we have strengths that we are doing better than other local authorities, or are there particular challenges here that other local authorities maybe have cracked, and maybe there's some learning there?
I think our strength is in our home care providers. We have resilience with the home care providers. I think nationally there is an issue
with residential beds and the availability, and then the cost of those residential beds. I think they're looking at it nationally as an issue. We're working with Kent County Council to look at the quality of care delivered in residential homes, because I think when CQC weren't able to go in and visit homes due to the COVID, maybe standards dropped, but CQC have invested their energies now in going and visiting, as has the quality assurance team, like our internal quality assurance team. So the provision is, we're kind of supporting those providers to improve their services, and as we're working with those providers, like on a one-to-one through brokerage and commissioning, we're encouraging them to kind of expand the provisions that they've got. We're also using Care Cubed as our tool to negotiate costs and establish a fair cost of care. So we're trying to provide a balanced market rather than this disparity in costs. If you come in as a private person who wants to self-fund their care, then you're going to pay more than if the local authority had sourced it for you.
Sorry, one more question. Thank you. And what about things like reporting functions? Because I think you said that that's something you're working towards. So is that just the systems that you're using at the moment? You talked about also kind of, sorry if I'm not getting the phrases right, but in terms of planned care or care delivered, you're trying to tally all that up. So is that just because the systems are outdated and you need to upgrade that?
I think it's not that, well, it is that the systems are outdated. We're using manual documents, we're using spreadsheets, and we use the spreadsheets that we've inputted to then produce reports. But that's us looking at every single line to pull out information. So if we're questioned about why it's taken so long to support that discharge from hospital, we can literally say, these are the providers that we've approached, this is why these providers have declined, and these are our next steps, and these are the new providers that we've approached. And now we've expanded on the area of search. But these systems have only just come about. They're being created over the last 2 years, I think, again, because as we came out of COVID, there was an investment in providers of systems. So the systems that we're looking at, we would be able to, instead of us looking at spreadsheets, we'd be able to kind of press a button and it's going to produce a report that says what we've done to support this person to be discharged from hospital, or this is how many placements we're searching for currently, these are the numbers of providers that we've gone to. And I think, have I answered your question? Or was there
I've got
another
Leanne that will just come in on that as well.
Thanks, Karen. And just to assure you, around delayed discharge, any person who has a delay over 10 days, I get to see that weekly. I get to see it, so that we have proper support and we work at pace, albeit that sometimes the market can't respond as we want, but certainly within the council, there is work at pace.
I was just curious if Medway 2.0 kind of encompasses some of these functions, because
I suppose that would be the digital brokerage and stuff like that. That will speed things up, hopefully. Thank you, Councillor Campbell. Finally, Councillor Howcroft-Scott.
Thank you, Councillor MacDonald. Thank you for your comprehensive report. Actually, Leanne and Smith, Councillor Campbell, did answer most of my question, but I would like to say, you know, thank you for all you're doing. You know, we've had the previous government 14 years of structural cuts and everything cut to the bone, and you know, need is growing, we know about that, and we live with the big sharks of profiteering. So, you know, you're doing really well, and that's much appreciated. Thank you.
Thank you, Councillor. Just one from me. It's just, you've got so many, I mean, you're doing a great job, both teams, I know, but with the amount of brokerage cases and stuff, are current staffing levels sustainable? Is it all good?
We're very fortunate in that we have fully staffed teams in both teams. They thoroughly enjoy their work, and I don't foresee them leaving.
But I'm asking, is there enough staff, Karen, or could you always do it some more, I suppose?
I think with the e-brokerage, there will be enough staff. I wanted to answer, because you did mention about, what was it? It was to do with the planned versus scheduled care. So we've introduced another electronic system as well that helps us to process invoices quicker. So instead of us like physically going into our social care system to see has that care, but you know, did we actually ask them to deliver that care? It's all done electronically. So there's lots of innovative ways that we're streamlining processes so that we can cope with the people that we've got. We don't want to bring more people in.
Thank you, Karen, and thank you for a really good report. Vice Chair.
I move that the committee notes the report.
Is that seconded? Agreed, members? Thank you. Thank you very much, Karen. Thank you, Sue. Moving on to item 6, waking up to sleep, the David's report. Obviously, just a brief, we have read the report, David.
Right, thank you very much. So yeah, I'll keep this brief. So directors of public health are required to produce a report each year on any topic they like regarding the health of their local population. Deciding which topic to choose is probably one of the most difficult decisions a DPH has each year. Whole range of things that we could choose from. When we were doing the engagement work for the Joint Local Health and Wellbeing Strategy, we had engagement with adolescents and with adults. And a key factor that came up with both groups that was affecting their health and well-being, influencing their health and well-being, was sleep. Something that hadn't really appeared in a big way in previous work that we had done. So we started looking into it in a little bit more detail and found that there were some really strong links with a whole range of core public health work that we do. Obesity, smoking cessation, alcohol consumption, etc. And it's a two-way relationship. So being obese means you're not going to sleep as well, but if you don't sleep well, you're more likely to become obese. And similarly for smoking, etc. It's more difficult to engage in healthy behaviours if you haven't slept well. There are very strong links with health inequalities, and more broadly, there are lots of links with the wider determinants of health, for example, bed poverty. Poor sleep is also an important contributor to lost productivity. And it's been estimated that the UK loses about £30 to £40 billion per year due to poor sleep. And with a little bit of play around with numbers, that could be around £200 million per year in Medway. There are some sleep problems that require clinical interventions, but for a lot of people, there are some relatively simple things that can be done to improve the way that they sleep. And what I'm hoping to do with this report is to raise awareness of the issue and then set it as a foundation for some work that we'll do over the next couple of years, including some campaign work. And there'll be a lot of things that we can build into our existing services that won't cost any money, where we can just ask people about their sleep and get them to think about ways that they can improve their sleep. Final thing I need to let you know is that the working title for this was Waking Up to Sleep. We've since found that Healthwatch has a report that also has that as their title, and there was also an RSPH report that had the same title as well. So we've now been working very hard on alternative puns that we can use for titles for the report, such as Dreaming of a Healthier Medway, or The Power of Sleep, a Wake-Up Call, and a few others. I'll finish here.
You should open it up for competition. If there's a prize, David, we'd be fine doing that. Members on this item. Councillor Jackson.
Thank you. David, I'm so glad you've done this report. This links really nicely into what I was talking about earlier, because lots of children and young adults with special needs have big problems around sleeping and become tired very quickly, but their rhythms are all off. Like my daughter will come alive at 10 o'clock at night, and so she was never fit for school in the morning. That had a knock-on effect to her mental health. But as we know, some of these special needs don't go away, so it goes into adulthood. And where they can get help when they're younger, they can get melatonin. When they get to adulthood, you're not allowed to prescribe it. So there's a real, it opens up this big topic of how do people with special needs get some sleep. A consultant once told me that it takes, for an adult with FASD, it takes 25% extra for their brain to work. So they get tired very quickly, and the school day, if we're going into adult, young adolescence, takes longer. So I am really, really grateful that you've opened up this conversation, because I think there's a big link to this, especially in the special needs arena, than there was in our first item. So thank you for doing this report as well. I think it'll really help.
Thank you, Councillor Jackson. Councillor Printer.
Yeah, thank you. Working in an industry where keeping concentration is quite an important thing, shift work as well affects your fatigue, and your description of people who suffer from sleeping, middle-aged, obese, male, literally fits the profile of most train drivers, unfortunately. We have a lot of cases of sleep apnea where drivers have been removed from driving due to performance issues, which has been linked to fatigue, and also sometimes the medical doctor won't sign them to be in charge of one. However, the company do put things in place, go to a sleep clinic very quickly, get a CPAP machine very quickly. But we're lucky we're in an industry that provides that. How is that for the community, though? How easy is it to get a CPAP machine? How quick is it to get into a sleep clinic to be monitored for these issues, for those who are outside in the community?
So the specifics of accessing sort of clinical interventions is something that I need to look into. So I don't actually know how easy it is at the moment. But more broadly, Medway's population has a larger proportion of its working population working in the nighttime economy than the England average. So it's a bigger problem for us here in Medway than it is across the rest of England. And we have a workplace health programme in the public health team, where we work with businesses across Medway to help them improve the health of their employees. And this is something we've done a bit of work on it a couple of years ago, and it's something that we're going to build into our routine workplace health program. So working with businesses, we aim to be able to help them to help their staff improve their sleep.
I mean, I can say it'd be really good to get some stats on that, though, if we can, about the sleep apnea machines, because I know most people end up not getting it from their doctors. They have to pay monthly subscription for it. So it'd be good to see whether that's an access to service issue. So, Councillor Finch.
Thank you, Chair. The report, David, contains a great deal on individual sleep hygiene, but far less on the real structural barriers identified, like low pay, shift work, overcrowded housing, rough sleeping. Does this not risk sounding like we're lecturing exhausted residents to fix their own sleep while avoiding the harder issues? Specifically, what does this report actually do for the alarm clock workers of Medway who are struggling simply to survive?
So the report, I think, covers a range of factors that influence sleep. So I do talk about homelessness, I do talk about housing being important factors, I do talk about the wider determinants of health of influencing people's sleep. So it's not just about the individual. As with most public health problems, it's an interaction between individual choices and the wider societal influences. And I think I've tried to capture that in the report.
Any other member? Okay. Vice Chair.
I move that the committee notes the annual public health report 2025.
Is that seconded? Seconded? Agreed, members? Agreed? Thank you very much. Thank you, David, for that. We look forward to, someone who has 3 hours sleep a night, I look forward to some solution to that moving forward. Item 7, Leanne, on Medway Council Plan Monitoring.
Thank you, Chair. I'm going to take this report as read, just to say that mixed picture, but slightly better in terms of direction of travel. Thank you.
Any questions, members, from the paper? Councillor Wiley.
Thank you. Hi, Leanne. A couple of things. Page 70 and 71, a third or less of the targets are in red. Sorry, about a third of the targets are in red. Now, I know the long trends may be improving, but that is where we are or where we were, because this is slightly out of date. But are any of them causing particular issues? And if I can carry on, page 81, safeguarding, I'm pleased to see is better than the national average. But I was worried about the life expectancy, which is worse than the national average. Those were my only comments.
I'll make a start and then I'll hand to you about life expectancy. These are long-term targets, so I think you've answered your own question, really. There will be a mixture. I'm not overly worried about any particular one at this point in time, and David will answer the life expectancy.
Yes, so life expectancy is a long-term indicator. I was just trying to have a look at the data to see when the last data point was. So it's usually several years in arrears. So the current position on life expectancy, I think, is quite possibly from a couple of years ago. It takes a while for the data to come through and for them to work out the new indicators. But ultimately, life expectancy is the sum result of everything else that we do. So it's not an individual thing, it's the result of all the other bits of work that we do. And it's not just what public health does, it's what we do as an entire system. So it's what the health system does, it's what we do in terms of creating a healthy environment. All of that comes together ultimately in that life expectancy indicator.
Yep, thank you. I was expecting Medway is doing very good on smoking, for instance. They've dropped, so they should improve going forward, etc., etc. So have you got anything you could add to smoking, which is the one that comes to mind? Sorry, I'm dropping you in it a bit. I don't mean to.
No, it's perfectly reasonable. So yes, so smoking, you're absolutely right. It has been a success in Medway. So when I joined Medway Public Health back at the end of 2011, the prevalence of smoking was around 25%. There's about 52,000 people smoking. We're now down to less than half of that. So that's 26,000 fewer people smoking, which has an incredible impact on, think about the impact that must have on reduced attendances at A&E, as well as impacts on people's health and mortality. I'll need to, the report here doesn't actually show the trend, so I need to look at the data. I think the most recent data points could well have been affected by COVID. So I just need to have a look at the trend, but it sort of went up and then came down during COVID because COVID had such a big impact.
Thank you, Dave.
Yeah, thank you.
Thank you, Councillor Wiley. Councillor Finch.
Thank you, Chair. Thanks. The report states that the local government reorganisation risk, SR59, has been reduced from B2 to C2, which is a significant downgrading. But there's no explanation offered about why the risk is now considered lower, what mitigations have changed, or why the confidence has increased. Could you explain that, please?
What page are you looking at, Councillor Finch? Can you tell me what part of the report you're looking at?
I want to carry on. I'll try and find it.
I want to try and get it for now, Councillor Finch, because I'm moving on to the next item. So, but if you got it from the report, I would have thought you'd have it in front. Leanne?
The explanation is in 138, on page 138. I think that should provide you what you need to know. However, I'm happy to answer any question outside of this if that doesn't suffice.
Thank you.
Thank you, Dan. Just to reassure members as well, and Councillor Wiley, we've said it a few times, all of us have, about the reports. I know Paul Boyd and others are looking at a new way of showing us them reports and making it more easier to read and look at those, what's going well and what's not going so well, instead of us just looking at a load of reds constantly or etc. So that is coming, I know, so we'll look forward to that. Vice Chair.
I move that the committee notes the progress of the performance in relation to the Council's priorities for Q1 and Q2 of 2025-26 as set out at Appendices 1 and 2 and notes the strategic risk summary as set out at Appendix 3 to the report.
And seconded, members? And agreed? Agreed. Thank you very much. Thank you, Leanne. Andy, I'm going over to you. Obviously, members have read the papers, so just a very quick at the front, please. And you're taking both reports, Andy, so you're taking either. Yeah.
Thank you, Chair. I'll keep this very brief. The reports here, there's two of them, Capital and Revenue. They were presented to Cabinet on the 18th of November and summarise the budget monitoring positions that have been considered by Directorate Management teams based on returns submitted by budget managers for the second round of budget monitoring for 2025-26. Briefly on Capital, there's a projected overspend overall of 58,000 against a total budget of 230 million across the Council, but the capital schemes within the remit of this committee are projected to complete within budget. On revenue, the overall reported overspend across the Council of £9.9 million is an improvement of £1 million on the position reported at round one. Within that overall overspend for the areas that are in the remit of this committee is an overspend of around £8.7 million. And officers are happy to take any questions that members may have relating to either of the reports.
Thank you very much, Andy. Members, any questions on the report? Councillor Wiley.
Thank you. Could you tell us, page 141, it's only one line, basic needs send. Can you tell us what's being built, or is that detail you don't have?
Well, obviously that would be under the remit of the CYP ONS, but it will be to build school places for send.
Yeah, it's not for this committee, Councillor Wiley.
No, okay, fine. Thank you.
Vice Chair.
I move that the committee notes the results of the second round of capital budget monitoring and revenue budget monitoring for 2025-26, in particular the risk to interest and financing projections, and that the committee notes that Cabinet have instructed CMT to implement urgent actions to bring expenditure back within the budget agreed by full Council.
I have a seconder for that, please. Seconded. Yeah, thank you. And is that agreed, members? Agreed. Thank you very much. Item 9, Dave. As per the previous speaker, please, just very briefly take it as read.
Yep, that's cool. Thank you, Chair. So again, this report was presented to Cabinet on the 18th of November, sets out the draft capital and revenue budgets for 26-27. The report reflects overall growth in the budget requirement of £40.9 million, income growth of £30.3 million, and it also reflects no use of EFS or exceptional financial support, which we had budgeted £18.2 million for in 25-26. The cumulative impact of that is a current budget gap of £25.8 million. The tables in the report for the directorates provide some more detail about the nature of the pressures and savings built into the draft budget at this stage. Work is ongoing to reduce their overall budget gap before the proposed budget is taken to Cabinet and Council in February. The committee is kind of asked to comment on the proposals outlined in the report under the remit of this committee for reporting back to BSD-ONS in January.
And thank you, Dave. I did forget to say to members, obviously you've done a really good briefing to us all as well. I know all ONSs had that briefing and everyone that attended said that it was a really good briefing it helps when we come to these meetings so we get a bit more in depth. Any questions on this, please? Councillor Wiley.
Just one quick one. As I've mentioned, the stop smoking services, page 148, because it's in red, I'm never sure whether that's an overspend or a cut to the services, or if you could explain that. It's at the top of the page in public health. third line down.
Sorry, so that's on the reports that Andy kind of went through. But in answer to your question, the figures in red are effectively underspends against those budgeted amounts. So we had budgeted to kind of so for public health. Well, you're looking at supporting what line are you?
Is this the previous item, Dave? Because we've moved on to
it is.
I'm not going to go back on it. But if someone can get back, Andy, would you better Councillor Mardy or just someone get back to Councillor Mardy?
Yeah, okay.
Thank you very much. Vice Chair.
I move that the committee notes that Cabinet has instructed officers to continue to work with portfolio holders in formulating robust proposals to reduce the budget deficit for 2026-27 and to liaise with the Ministry of Housing, Communities and Local Government to secure support through the Exceptional Financial Support Scheme, should it be necessary, and for the committee's comments to be forwarded to the Business Support and Digital Overview and Scrutiny Committee.
Thank you. Is that seconded, members? Is that agreed? Agreed. Thank you very much, Andy and Dave. Keep doing it. Item 10, work programme, please.
Okay, I only have one update, which is that following the HAS meeting last week, the all-age mental health contract transfer to KMMH has been added to the agenda for January. Otherwise, I'm happy to take any comments from members and feedback to Terry.
Thank you very much. Just to update everyone that the Chief Exec of KMPT, MHH, whatever they are, she will be attending in January to this committee. She has confirmed she will be sitting in front of us instead of having the empty chair. So that's really good news. Is that Vice Chair, please?
Sorry, Chair.
Councillor Wiley, sorry, I didn't realise you had a question.
No, no.
Come back.
You said it's agenda item 10.
Am I out?
I thought that's
item
what you
11.
said.
I've got 10 on my item 11. Yeah. It's the
Okay,
work
fine.
programme. Stephanie's talking, so we all
Right, I was one behind on everything, so.
No
okay.
problem. Don't follow me. Follow your own papers, Councillor Mardy. It's the safest bet tonight. Follow that or ChatGPT. That's the best option, I think. Stephanie, we've done work programme. Vice Chair,
It's just
it's
when
item
the
11.
capital and revenue were combined, the number went up. But
I
yeah,
combined
anyway,
the
sorry.
two together. Sorry, that's what I did, David. I combined them. Vice Chair.
Sorry, the
The
chat
third
GPT
time.
really distracted me, but okay. I move that the committee notes the report and agrees the work programme as set out at Appendix 1 to the report, subject to accepting the proposed changes outlined in italic text on Appendix 1.
Is that seconded, members? Is that agreed? Agreed. Can I just wish all members, obviously it's the first time I'm saying it, is I wish you all a very happy, many of us will see each other at some other committees, but those that won't, wish all a very happy Christmas, especially the officers. It's been a really difficult year. And Leanne, if you could take back to all your officers, everybody that's come in front of this committee, it's not the easiest committee, I know. Please take our thanks back to them. I know Christmas is hard. Many of your teams will still be working, but please take back our thanks and thank them for their honesty over this year. And to those statutory partners, I wish them Merry Christmas too, even though they may not always like coming in front of us. But I think they're going to have a bit of the same all next year as well with the challenges ahead. But thank you, members, and have a good evening. Thank you.
Thank you.